Thanks, Eric. Appreciate it very much. And thanks everyone for joining us today. So I'm Brian, if I could get you to head to the next slide. I think, we're lucky here at Ribbon. We're very fortunate to have some of the largest healthcare organizations in the country who are our customers and, in some of the biggest cities. And I've had a chance over a number of years to visit with a large number of them. And, particularly in the last few years, we've seen kind of an interesting change in how providers see their communications environment. And I tried to sort of define it here on this slide. I think, and I'd be curious to hear as we get into the open session later whether you all agree, but what we see is a big change where we have a number of providers have very traditional phone requirements. They need to have the disposable room phones in the hospital. They're still using things like fax. A lot of the calling is interdepartment. You're not calling to an individual, you're calling to the person who's working on the third floor in the X-ray department, things of that nature. And those people are still using traditional hard phone devices. And of course, they're working in an office in the environment. But at the same time, particularly since the pandemic, we've seen a huge growth in cloud collaboration tools, right? And obviously these are for telemedicine, but I think more typically you see the kind of, I'll call it classic business collaboration environment where you have a administrator who wants to, talk about budgets with their coworkers, and they want to share a spreadsheet or a PowerPoint presentation. And a lot of those people are now in a position where they've learned to work hybrid. They're at home maybe 1 or 2 days a week. Maybe they're mobile part of the time. And they're operating off of clients like I am here today, or mobile devices. So we have this kind of odd scenario where you have, all this traditional telecom, but it's now being mixed with sort of the more modern cloud-based collaboration. And Brian, if I could get you to move to the next slide, I think part of the challenge there in this diagram, and I know it's a busy diagram, is that as that change has happened, we've seen a change in threat parameters. So if you look on the left, you see kind of what I think most healthcare environments look like 5 years ago, which is, hey, I had a PBX, maybe I had a contact center. It's all in one building or in a group of buildings. And basically, I worried about what was happening outside of me, and I tried to secure it, right? Which is I created a perimeter around myself, and I knew that the people who operated inside of my environment were safe, and the people who were outside of it I had to worry about. Now, if you look on the right-hand side, I think today what we see more and more is this kind of mix where we still have some people operating in that internal environment, but they're a subset, right? Actually, what's happening is a lot of more of my users are remote, particularly contact center agents, but all the folks we talked about in the last slide. And then I have a mix of software. Some of it's my PBX might be running in that blue circle on the right, but my contact center software or my cloud collaboration software might be up in the cloud. So as a result of that, we see a lot more places where potentially people are trying to threaten the organization. We hear ransomware, trying to get personal records, all the things that healthcare providers worry about. There's more places that you have to think about securing the solution. And so if you move to the next slide, Brian. So at Ribbon, what we've seen is really the summary is there's a tremendous need to integrate all these disparate elements and secure them, right? So what we see happening, and I think what Joe and Kevin will talk about, is this need to be able to bring together the legacy pieces and the new pieces and create a contiguous environment. It needs to be cloud and premise. It needs to be vendor agnostic. It needs to be transparent to employees and to patients. Probably most of the folks on the phone, certainly us, we're all technologists, but for the everyday employee in a healthcare environment, they don't want to know how the phone system is put together. They want to dial an extension and get the person. They don't care what system they're connected to, right? So all of those things have to happen, and then it needs to be incredibly reliable because you're in a healthcare environment, and it needs to be incredibly secure. And that's what we focus on today at Ribbon.